Hey guys, it's Midwife Kira here to talk to you about another one of our frequently asked questions. So a question I get often is, when do we start routine vaginal exams? And that's something I actually really want to touch on here. It's very common in a physician's practice that vaginal exams routinely start at about 36 or 37 weeks, and they happen weekly until you deliver. And to be honest, I just don't agree with that. I personally believe that vaginal exams are one of the first interventions that we apply to pregnancies, and they're really kind of unnecessary. So a lot of clients will come and they'll say, oh, well, I want a vaginal exam this week. I've been contracting off and on for the last 2 weeks. I just want to see if it's doing anything. And the truth is, your vaginal exam does not tell us anything about when you're going to go into labor or how close you are to going into labor. All it really tells me as your healthcare provider is how much less work you're going to have to do when you do go into labor. And by less work, I mean dilating and effacing. It does not tell me anything about how fast your labor is going to go. And I know that that's a little contrary to popular belief, but let me give you some examples. So early in my apprenticeship as a student, I had a mom who was 8 centimeters for 3 days with no contractions. It would just happen to be a vaginal exam that she had requested, and she was 8 centimeters. I've had moms, I was one of them, no, nothing, 0, maybe 1 centimeter, not effaced at all. And then I went on to go into labor that night, and I had my baby in my arms 11 hours after that vaginal exam. So I guess what I'm really trying to say is this idea that we need to have vaginal exams the last few weeks of our pregnancies to tell us how close we are, they're really not beneficial to us in any way. And in fact, I believe strongly that they cause a lot of unnecessary anxiety. So the reason why vaginal exams are implemented routinely is because physicians are typically assessing moms for an induction. They're using a tool called a Bishop's score, and this score tells us the likelihood that a mom who's being induced would end up needing a C-section for delivery. And so this is a really useful tool for moms who are having issues that require an induction, such as preeclampsia, gestational diabetes, things like that. The Bishop's score is a very useful tool, but it's not something that should be implemented routinely. And so in my opinion, as your healthcare provider, I just don't feel like we need to be doing vaginal exams. And so all of this to say, our vaginal exam really doesn't tell us a whole lot, and I really want to encourage you to not expect it at your appointments, and even, tell your friends. Like, I'm a firm believer that if we were supposed to know what the cervix is doing, it would be on the outside, right? And it's not. And so this culture that we have where we're just walking around asking women about how dilated they are, I personally find that extremely inappropriate. In my practice, if a mom requests a vaginal exam, of course I'll examine her, but I really try to discourage it because the anxiety that it causes is really unnecessary, and it really doesn't give us any information.